Lung cancer is the leading cause of cancer death. Lung cancer causes more deaths than breast cancer, colorectal cancer, ovarian cancer together.
I thought long and hard about going public because there's a stigma associated with lung cancer.
There has been a stigma towards lung cancer that it is self-made, man-made disease, which is absolutely not correct in many cases. Unfortunately, it hit never smokers, younger people.
When I was first diagnosed, with tuberculosis. I started getting treatment for that, but obviously, my breathing wasn't getting any better.
I had bad pain in my hip. When I went to see my doctor about that, we did an x-ray and you couldn't really see anything in the x-ray. I was diagnosed with arthritis.
I was running marathons, not a single lung symptom.
I was admitted into the hospital immediately after my biopsy, which was not expected or planned.
And it was about a week after that I had a lung biopsy and then got a confirmation that I had non-small cell lung cancer.
A few more scans later, we discovered that that the hip pain was due to the cancer spreading there. And it spread throughout both lungs.
And it turns out, had tumors in the lung, in the bone, in lymph node.
But it became a crisis situation and they started me on chemotherapy within 24 hours.
I was diagnosed after a slight wheeze and a cough with stage 4 lung cancer at age 28.
What's most important for patients that are diagnosed with lung cancer is that they really understand all of the available therapies that they might be a candidate for.
In my clinic, we don't even decide on the first treatment for a patient until we have next-gen sequencing analysis for the tumor's oncogenome.
I participated in the Lung Cancer Mutation Consortium protocol clinical trial, which tested for a range of mutations.
I was found positive for the EGFR mutation.
We found out that I was ROS1 positive.
I have an ALK mutation.
My exact mutation, ROS1.
I tested negative for all known genomic markers, so I started with traditional chemotherapy.
Every patient is unique. Every tumor is unique.
We are, in lung cancer, a role model for modern cancer therapy these days.
As of last year, if I had failed on this clinical trial at some point, and I know I'm going to progress sometime, there were no options for me except to go back on chemo. And this year, there's at least 4 other trials I can go to. So progress is being made.